my name is Kindra Cutler, and this is my partner, Sara Anderson. Today, we are excited to talk to you about silver diamine fluoride.
We are so excited to talk about one of the most non-invasive, preventative, and proven products in dentistry. Dr. Jeremy Horst treated a handicapped 4-year-old patient who had been through restorative care under general anesthesia to treat 12 caries lesions, which included 4 stainless steel crowns and 8 composite restorations. A year later, all the composite restorations had failed due to recurrent caries, and the patient had 9 new lesions. Because of a near-death experience under general anesthesia, the parents refused invasive treatment. Dr. Horst decided to treat with silver diamine fluoride, or SDF. With 3-month applications, only 1 lesion continued to grow, and after 3 years of reapplication, the patient had 0 carious lesions. SDF is composed of 25% silver, which acts as an antimicrobial, 8% ammonia, a solvent, and 5% fluoride, which aids in remineralization. These components work together to form a defense against caries. The caries penetrating into dentin are met with silver as far deep as 2 millimeters. This creates a tensile strength, which is able to slow and even arrest caries in the tooth. While clearance may be new in the U.S., silver nitrate alongside fluoride has been used for many years all around the world, including in Japan for over 80 years without a single adverse effect.
If a cavity is left untreated, it will continue to grow. When SDF is applied to the surface with decay, the squamous layer conjugates with the proteins of the silver to help aid in resisting acid and enzyme digestion. The treated lesion will increase in mineral density and hardness, while the depth of the lesion will decrease. SDF inhibits the breakdown of proteins in the organic matrix of the exposed dentin. The silver ions in SDF act directly against the bacteria in carious lesions by breaking down the membranes, denaturing the proteins, and inhibiting the replication of caries-causing DNA.
SDF offers one of the best alternative methods to invasive treatment. SDF success rate is similar to restorations placed under general anesthesia, but offers a procedure that is 1, a fraction of the cost, and 2, has no recovery time associated with placement. 70% of patients treated under general anesthesia are estimated to get 1 new carious lesion within a year of treatment. That number is reduced to just 30% for patients treated with silver diamine fluoride, which not only aids in remineralization, but also acts as a preventative against further caries. SDF was cleared in 2014 as a Class II medical device for treating dentinal hypersensitivity, and it works great in this area. The Breakthrough Therapy Award was given in 2016, acknowledging SDF's ability to treat severe childhood caries, and is on track to become the first FDA drug approved for the treatment of carious lesions.
When SDF is used 1 time a year for prevention, it is 62% effective against new lesions and is 81% effective against existing lesions. When used twice a year, it is up to 90% effective opposed to fluoride, which is only 37% effective when applied 4 times a year.
The UCSF released protocol for patients who would benefit from treatment with silver diamine fluoride. The first indication for use is those with extreme caries risk, or those suffering with xerostomia. Those who cannot tolerate standard care, with those with medical or psychological disabilities, elderly, dental phobias, or uncooperative children. Also patients with multiple carious lesions that can all be treated in just 1 visit. And also those lesions that are difficult to access, root caries, infiltrations, and on the occlusal of a partially erupted wisdom tooth. But the most outstanding reason for the use of SDF is for patients without access to dental care, because of the ease of treatment and low cost. Because there are no adverse effects from failed SDF treatment, it will not harm or create an environment that promotes caries, such as a failed filling would. SDF is sold as Advantage Arrest, 38%, and the recommended dose is just 1 drop per treatment. The only contraindication is a silver allergy, which is extremely rare and is often mistaken as a nickel allergy. Relative contraindications include ulcerative gingivitis and stomatitis, pregnancy, and breastfeeding. So to apply, dry and isolate the area, then take your microsponge, dip it into the SDF formula, which you can pour into a little bowl on the side of your tray, and dip in 1 drop and directly apply to the lesion. Allow to dry for 1 minute. That's it. You've done it. You've applied SDF. Advantage Arrest is $129 a bottle, which contains 250 drops, which is equivalent to about 52 cents a drop for treatment. And its best results, reapply every 6 months. As students, we have both used SDF and found it easy to use, and even with the adverse effect of turning a lesion black. With the benefits, our patients were still willing to have the treatment done.
My patient, we applied SDF, and they were totally thrilled about the benefits of it, that they didn't really care that it wasn't as aesthetically pleasing because it was in the posterior. But one of the adverse effects of SDF is that the SDF will permanently stain a carious lesion black. However, if this is bothering you or something that you're not liking, they can be filled or get a crown. Also, informed consent is extremely important to make sure that patient is aware of the staining, and written consent is recommended.
SDF is easy to apply, offers non-invasive treatment that works, is cost-effective, and improves access to care and the quality of care that we give as clinicians.